Hi everyone, I'm Paige Abbott and this is your weekly recovery message. The question of what is abstinence may seem like a pretty clear and straightforward one, but when it comes to especially addiction beyond substances, it is a little bit more unclear because there are certain behaviors like food, work, shopping, exercise that people may notice their addiction manifests in. However, we can't remove these behaviors completely. So in those cases, and even in drug and alcohol addiction, I think it's important to come back and revisit what is abstinence. And the ASAM, American Society of Addiction Medicine, definition of abstinence is the consistent pursuit of restraint. And the word that I really latch onto in that definition is the pursuit of restraint. So it doesn't actually always mean that people with addiction will be necessarily successful, meaning that there will be 100% ability to abstain from their substance or behavior of choice. But what it does mean is that they're trying. And the pursuit of recovery and that pursuit of restraint is what is key to look at in your own personal recovery and also the recovery of people around you. So a lot of people will believe that if somebody has used or acted out in their disease, that they can't associate with them any longer because they're no longer in recovery. Well, that may not necessarily be the case. So addiction is a relapsing remitting condition and it will flare up from time to time. Whether those flare-ups manifest more at the cognitive level, addictive thinking, some distortions, black or white, all or nothing thinking, at the level of feeling, overreactions, underreactions, not being able to cope or process feelings that are coming up, spiritually, that just spiritual disconnection, socially, isolation, or there could be a behavioral relapse. So the relapsing part of this disease can impact a person at all different levels. However, just because somebody has a behavioral relapse does not necessarily mean that their disease has totally taken over and they're no longer pursuing recovery. So the important thing to pay attention to for yourself as well as the supports around you is what happens sort of around and after this behavioral relapse. Are they continuing to pursue restraint, which would be the definition of abstinence, and are they continuing to engage in recovery tools? Are they reaching out? Are they processing their feelings about what happened? Are they learning from it? Are they still engaging in all of those recovery pieces that they had been before and maybe looking at some changes they can make? If the answer is yes, then this person still is in recovery. It's just that the disease got them in that moment. Now, somebody who is relapsing behaviorally and really has no interest in pursuing restraint and really isn't focused on recovery, that's a different matter. That's somebody who is lost and stuck in their disease. And if this is an external support person, you may need to look at drawing some boundaries with that person and maybe detaching or disconnecting until they are recovery focused. Now, I want to be clear, the purpose of this message is not to give people permission to act out or relapse in their disease. It's just to have that realistic appreciation that relapse with addiction does happen, and usually quite frequently. And I'm not just talking behavioral relapse. So relapse can happen in many different shapes and forms, spiritually, cognitively, psychologically, or emotionally, and behaviorally. Just because there's relapse happening in any of these levels does not mean that the person isn't necessarily pursuing abstinence or restraint and focusing on recovery. So I hope that this gives you a little bit more clarity on some topics that do commonly come up when people are looking at things like sobriety dates and where they're at in recovery. I wish you the best in your ongoing journey of recovery for the week, and I'll talk to you next week. Bye for now.